Right, welcome to our webinar. We are from Nurse Growth Academy, and today's webinar we are presenting on discovering your APRA stream, where we will discuss about how you can find your stream, and especially designated for internationally qualified nurses. Myself, Baljinder, I'm the co-founder of Nurse Growth Academy, and we also have Marina. So we are both nurse educators and co-founders of Nurse Growth Academy. So that's all about us for now, but let's get into our topic today. Okay, just quick housekeeping rules. We have turned your microphones on, but obviously you can ask questions in the chat, pop it in, or we will have a few questions that we'll ask you throughout the presentation, and we're more than welcome to share your thoughts or if you have any additional questions. But we are hoping that we will cover most of your questions while in our presentation, but there might be some that we may not have covered, so you have the opportunity. But just a disclaimer that we are recording this session. So if you have any objections to that, please let us know. Otherwise, we just assume that you are happy for us to record, but you will be sharing it with yourself and other attendees who can entertained. Okay, so just tell us where you are joining us from today. In terms of where we are at the moment, I'm in Australia, in Brisbane at the moment, in Queensland.
And I'm in Melbourne.
Yeah. And just pop it in the chat, Erica and Drew, where you are from, just to give us an idea. While you still typing, or you may be trying to find the chat button or something, we will just keep going. But along the way, if you can type in, it would be nice to know exactly where you're from. So in today's presentation, what we will cover, we will talk about what nursing demand looks like in Australia. And that will give you a bit of an idea why this process was developed to start with. And then we will talk more in terms of the whole process of how an internationally qualified nurse can apply for APRA registration. There are a few steps which we will discuss, starting from self-check and then how you identify your streams, and then based on your stream, what sort of exams that you need to give. In this webinar, we will mainly be focusing on stream B, and that's why we have a special mention of NCLEX and OSCE overview, and then we will talk. We will end up with some OSCE locations, bookings, how you look into those exams a bit further down the track.
Eric is joining us from the Philippines.
Lovely. Beautiful. I think it's a nice evening time in Philippines at the moment. 4-ish o'clock.
Yep.
And we have Lintel joining us today. Hello.
Welcome.
So Lintel, we have put everybody on mute for now, but you can pop it in the chat where you're joining us from today. And we just started with our, this is slide number 2 or 3. Right? So why Australia needs international nurses? You would be wondering why all of a sudden APRA opened these pathways. So we are anticipating quite a critical shortage of nurses and midwives in Australia. This is due to the population being aging, and then the disease burden is quite increasing, which is like worldwide, but also very high in Australia at the moment. And since COVID, especially the existing nurses and midwives, they are feeling burnt out and their attrition rates are low. So they are leaving profession quickly, or most of the nurses, as we've experienced, they work part-time. No one wants to work full-time. This is because of their workloads and the expectation, and the disease burden is increasing, which means we are seeing sicker and sicker patients. So, and therefore the demand in hospitals and aged care is increasing. In a government report, there we are facing a shortage of 70,000 plus nurses by 2035. So that is within next 10 years. These are the number of nurses we needed and where they're coming from. That's why APRA and our nursing bodies, they have opened up pathways for international nurses to come and join Australian workforce. So that gives you a bit of idea that where the demand is. So you would have heard of these words, APRA and NMBA, and let us explain a little bit about what their role is in this whole process. So APRA is an Australian health practitioner and regulatory agency, which means that it manages all the healthcare professions and manages their registration and also their code of conduct. So if any professional, this includes nurses, midwives, medical officers, physios, OTs, you name it, like any healthcare profession. So they manage their registration on yearly basis, and if there are any misconduct or they are not working within this scope of practice, that's what APRA manages that. Additionally, in terms of internationally qualified nurses, NCLEX and OSCE exams are conducted by APRA. And then NMBA, on the other hand, is a specific Nursing and Midwifery Board of Australia, which means that this body regulates, sets the RN or RM standards of practice so that they define what is safe practice, what is unsafe, and that provides us, the nurses and midwives, the basis of how we practice in Australia. So APRA basically makes sure that whatever standards are being set by NMBA, APRA makes sure that all the registered nurses and midwives are actually abiding by those standards. So therefore, all the exams that they conduct, they're also based on these standards. So, as I mentioned, that because of the increasing demand, APRA and NMBA, they work together. So they change the process, how internationally qualified nurses come and work in Australia. Before this process was introduced, that was around 2017 or 18. Before there were bridging programs and there were some inconsistent pathways. So there was one nurse will come through this pathway, another one will come through this pathway, and they were quite long and quite costly as well. And then APRA and NMBA, they realized that it was actually not an efficient process. So, and to see that the predicted shortage, they actually created more streamlined pathways. So the pathway they have created, they're called outcome-based assessment. They are mainly focused on competency and safety and making sure that the nurses who are coming in, they do acknowledge their previous experience, their previous qualifications, and they want to make sure that they have that add-on component of understanding of Australian healthcare system. So that's why there are a couple of steps in this process, but it is not as meticulous as it used to be in previous times, bridging programs that you have to spend these many hours clinically, or you have to do a year or 2-year course in universities. So that's all gone. So the process, the number one step in this process, so if you are an internationally qualified nurse and you feel like, okay, I want to go and work in Australia, what should be my first step? So this is your first step. Doing a self-check on APRA's website. There is a link here. But Marina, can you drop the link there?
I'll share that in the chat for everybody.
Beautiful, thank you. So this is a free step where you can if you want to see, am I eligible for APRA's streamlined pathway or not? This is where you want to go, and it will take 10 to 15 minutes. It's an online questionnaire. You don't have to submit any documents at this stage. All it will ask you to create a portal on APRA's dashboard, on APRA's website, and that will give you then an outcome in their portal about, okay, whether you belong to stream A, B, or C, or whatever. So this is your absolute first step, okay? After the webinar, you can, if you've not done this before, you can do this. But for sake of time, we will just keep going. So what happens after you do the self-check, and you will be given one of these three outcomes, okay? So you will either be assigned stream A or stream B or stream C. So what does these streams mean? So based on the information you shared in that questionnaire, if your qualification was identified as substantially equal qualification to Australian bachelor level degree, and that degree was gained in one of these countries, UK, Ireland, US, Canada, from a couple of those states, or Singapore or Spain, and you do have a recency of practice and you hold a current license as an RN in your own country. And with the recency of practice, you should have a minimum of 1,800 hours of nursing practice, which is equal to like 1 year in clinical practice. Okay, so if your information match this criteria, you will be assigned stream A. Okay, so we'll explain in probably next slide what does that mean if once you're given this category. And stream B, on the other hand, if your qualification is relevant, which means it is a bachelor level nursing degree, but is not equal to Australian bachelor level nursing degree. So that is, for example, if you have done your bachelor's from countries other than those listed in stream A. So these are a few examples. For example, most of the Asian countries, South Asia, continent like India, Nepal, Vietnam, Sri Lanka, or Philippines, or from other countries like Zimbabwe, Kenya. So those countries, if you said that you have that qualification and you're from one of these countries, your institute for bachelor's level, you will be assigned stream B. Okay, stream B is also called outcome-based assessment pathway. So what does that mean? That you are required to complete a couple of exams before you are given registration. So one is your NCLEX exam and also an OSCE, which is a practical clinical skill exam. If you are assigned stream C, what does that mean? That there are some gaps in your education or your qualification is not relevant or equal to a bachelor level qualification in nursing. So an example of this is if you are holding a diploma in nursing or midwifery from your home country, or GNM, general nursing and midwifery, that's when you will be assigned stream C. Or if you haven't practiced or you don't hold a current license for a registered nurse and a gap of more than 5 years in your practice and your study, then you might be assigned stream C. There is another category that you might be assigned, which is called unknown category, which means that the information you shared is not enough for APRA to determine your stream. All that means is that they will require you to submit or provide them more information before they can determine your stream. But that's not like that's the end of your path. That is just that they need additional information. Okay. So sorry, let me just go back explaining about stream A. When I said if you fall in stream A, you don't need to do any additional exams. All you need to do is submit your documents to APRA, and they will require your English language evidence, or you should meet their English language requirement, which is like for any stream. and then you will be granted registration with APRA. Okay. So based on that information, you would have already determined your stream without even doing self-check. So if you want to drop that in the chat, that which stream do you think you belong to? That will just give us a bit of an indication. So you should have your bachelor level qualification. You should have your current RN license. And there is no as such any experience required for stream B, but for stream A, you need to have 1,800 hours of recent clinical practice.
Thanks, Lintel. That's stream B for Lintel.
So what we got? We have a couple of stream Bs.
Yep.
Oh, everybody's stream B.
Yep, true. And Erica are all stream B as well. Amazing. You're in the right place.
Beautiful. Beautiful. So very good. We're all going to keep going because the rest of the session is very relevant. So, so your next step after you've done your self-check, then if you want to proceed further, then it becomes a bit more formal. So that is called portfolio submission. So now this is your official engagement with APRA. So you will have to proceed with paying a fee of $410 to APRA, and then there is a part that they will ask you to complete, which is an orientation part 1, which is like for any stream A or B, or if you want your qualification to be assessed by them. So you do that, and orientation part 1 is basically just orientation to Australian healthcare system. And once you do that, at this step also, you will submit your paperwork, your official transcripts, your identity proof, and your certificate of your recency of practice, any of those documents. There is quite a list. And once you do your portfolio submission, then APRA will usually respond back to your inquiry. So it's really important that all your documents are submitted in the right format, that they've been rightly tested by a notary, and they are translated in English. So they're very particularly about that you should have at this stage to prevent any delays in your process, that you must submit all the documents in right format and right requirements are met. Okay, so usually that stage will take 6 weeks or so if you have done everything correctly at that stage. And then APRA comes back to you with a next step. So your next step usually in this case is NCLEX exam. So that's where they'll ask you, now you can book your NCLEX and provide your results. So NCLEX, most of you will be familiar with this. It's an online theory exam, valid for 10 years. It's conducted through Pearson VUE centers, which are located worldwide. And it is a similar NCLEX as it's required for US or Canada. And you can request for transferring your results to APRA. You can even do NCLEX prior to going portfolio submission. Or if you have had this NCLEX exam done, you can still proceed with APRA's process. And when they ask for NCLEX results, you submit it, or you can submit it at portfolio stage. Either way, they will accept it. So once you have provided them valid NCLEX results, your next step, usually APRA will advise you that the next step is OSCE exam. So OSCE stands for Objective Structured Clinical Exam. And this is probably the most expensive and high stake step or exam for internationally qualified nurses. Um, so basically, APRA sends you that you need to book your OSCE. When you book your OSCE, you have to pay a fee of $4,000 here to APRA, and you book your exam date, and they will give you few options to choose from. And the most important step here is that this exam is conducted onshore in Australia at Melbourne and Adelaide. So you usually come here on a tourist or a visitor visa to undertake this exam. The format of this exam is that there are 10 stations and 10 minutes are allocated to each station. It is conducted in a simulation setting, could be a hospital setting or a GP setting. There will be actors acting as patients, or they might be mannequins. So you would be asked to perform as you are performing in a real hospital setting. So there'll be an examiner sitting there assessing you. So you are only assessed at a graduate entry level. So it's good to remember that you won't be asked to perform any advanced skills. These are really basic nursing grad level skills. Okay, but it is the important bit to remember and know is that it is quite timed. So they're quite strict on times. You only get 8 minutes to perform the skill and just perform it correctly. So what, Maria, do you want to take from here?
Yeah, no problem. So your OSCE assessment is not only your clinical skills, but it covers four main domains. So APRA is extremely strict on safety, your communication. So this is not only with your patient, but if there's a relative present or other healthcare workers, clinical skills, as I mentioned, and your professionalism. But remember, not everything is a direct pass or fail. So you've got your 10 stations, and throughout your 10 stations, you need to make sure you're consistently performing each of these skills. So if you forget hand hygiene in one station for the first time, don't let that throw you off. You haven't failed. You've got the opportunity across your other 10 stations to make sure that you can indicate that you can maintain infection control principles. Just got a comment here, Belginder. Is there a specific US state that we should take the NCLEX exam? No, Drew. So you can take the NCLEX RN for Australia, but if you've already done it in the US, that is fine. You can get the results transferred over to APRA. So any state is fine as far as I'm aware. So common OSCE skills. So these are the 10 skills that they exam for. So vital signs, medication administration. So this could be oral medication to pediatric patient, could be a subcut or an IV medication, aseptic technique, like a simple wound dressing, IV therapy, setting up your IV fluids. Blood transfusion, so this could be starting a transfusion or a patient reaction to a transfusion. Basic life support could be adult or pediatric. Risk assessments, maybe falls or skin integrity. Focused assessment, so this could be any focused assessment, could be respiratory, could be cardiovascular. And then your SBAR communication and pain management. So your pain management would be non-pharmacological interventions. No worries, Drew. Next slide, please be. Yep. So common mistakes. So we all get nervous. We all make mistakes. Nobody's perfect 100% of the time. So like I said, you do have the opportunity if you do make a simple mistake in one station to move on and show you can do that skill in your other stations. But most commonly, it's going to be hand hygiene. Your ID check. So we need to make sure you're checking 3 identifiers. So that would be name, date of birth, and if they're in hospital, it might be their hospital number, or if they're in the community, it might be their address. Unsafe medication practice. Have you checked the drug? Have you checked the your 6 medication safety rights? Failure to escalate. For example, if you've got a high blood pressure, do you know that you need to escalate that to somebody, a medical staff or a team leader? Incorrect manual blood pressure technique. So we're all pretty reliant on the old BP machines these days. So make sure you're familiar with taking a manual blood pressure. And then not acknowledging the patient's concerns, like the blood transfusion that I mentioned earlier. If your patient's anxious about their blood transfusion, are you addressing that and making them feel safe in the interventions that you're performing? So OSCE locations, as Belginda did mention briefly earlier, there are two locations. They're in Melbourne or in Adelaide. These are the only two places within Australia where these exams take place. So once you have passed your NCLEX, you will receive an invitation from APRA to book this online. So they will offer you some dates. You are able to say that you don't accept the dates initially, and then it'll be up to you to find a suitable date that you can agree upon the location as well with APRA. So this is what a typical Stream B journey is going to look like. So we're all Stream B today, which is really great. So you're going to do your self-check, which we mentioned is free, and we've got the link in the chat. Next will be your portfolio submission, and that is all of your paperwork formally in through APRA, and they will again confirm that you are Stream B, and they will invite you to the next step, which will be your NCLEX. However, you have already done it, this would be your opportunity to pass your previous results because they are valid for up to 10 years. And then your OSCE. So as Belginda mentioned earlier, this will be on site in Australia, in Melbourne or Adelaide. These are the only two places you can do it. And then you will need to do your English exam. So there's actually 5 different what's the word I'm looking for? I'm going to say schools tests that you can take. So we've got IELTS and the OET there, but there is 5 different ones that APRA will accept. So make sure that you do check on the APRA website as to which one they accept, and you don't do one that is unacceptable. And then once you've done all those things, you apply for your registration, and everything will go well. So
Thanks.
whereabouts is everybody in your APRA journey? Are you just still sort of gathering information? Have you already completed your self-check, preparing for your NCLEX? Drew, it sounds like you maybe have done yours already, passed your NCLEX, and you're ready for your OSCE booking. Do you want to drop a comment and let us know where you're up to on your journey?
We have Jenna who joined us just now. Hi, Jenna. We are right towards the end, but
Yeah.
don't worry, we will share a recording.
Oh, great.
But yeah, we are just at that stage of just asking everybody a question that what stage of your opera journey you are at the moment. If you're just exploring, I know we all get
Oh,
home
night shift.
duties.
Yeah.
Yeah.
So everybody's at quite different stages. We've got Erica is getting ready for her NCLEX. Drew likewise, and then Lintel hasn't started yet, but that's okay. You're in the right place. You're starting off with the right information, Lintel, so it's a great place to start. And then Jenna's also preparing for NCLEX. Fantastic.
Certainly.
Next.
Yep.
Okay. So who are we? So Belginda briefly introduced us in the beginning, but we'll give you a little bit more information now. Belginda and I are both nurse educators. We work in public hospitals here in Australia, and we have got combined 45 years of nursing experience between the two of us, with 10 years experience as nurse educators. But part of our role in our public hospital education is delivering simulation-based training. So the OSCEs is our expertise. This is what we do on a daily basis in our paid, government jobs. And we do have the added privilege of Belginda has previously been an APRA OSCE examiner. So all of our learnings and teachings and everything we're prepared for you guys has come straight from Belginda's insight as to what APRA examiners are actually looking for. And we're making sure that we are covering all bases. And then Belginda's also been an internationally qualified nurse herself. So came to Australia 18 years ago. The pathway was different then in terms of she had to actually go back to university and retrain. However, is very familiar with all of the challenges of a new country, a foreign government body you're dealing with, language, all of those sort of stressful things we've tried to accommodate for and try and minimize how that impact for you guys in your APRA journey.
Yes, thank you, Marina. And that definitely I can say it first-handed how challenging it is to, navigate a new country, new language. I remember the days when I could not understand when someone will talk to me. I worked in a nursing home and I will always just say yes because, you want to be, that you are there, but, the challenge, it's not that you're not competent. It is about different accents and the speed, everything. So, and the nervousness of being in a different culture.
Yeah.
So very, very obvious, fears and challenges that we understand.
Yeah.
Um,
Yep. So we do provide a variety of services. We've trying to make sure we're supporting you through your entire APRA journey. So whether you're just starting or whether you're ready for your OSCE, whether you're ready to arrive in Australia, so we can support you with your portfolio, NCLEX review, your OSCE preparation. We do have immigration partners who can help you with right visas and employee sponsorship. And we've also can help you with your CV and your job readiness. So we know from our role at government hospitals, we do a lot of recruitment. So we are familiar with what Australian recruiters are looking for in your CV and in your interview prep. Next, yeah, good. So, final message. The pathway has been streamlined by APRA and NMBA, so hopefully it's a lot clearer from them and for us to deliver this message to you. Skills are trainable. Most of these skills, well, not most, all of these skills you have. So don't stress. You know what you're doing. It's just knowing how to do it within that 8-minute time frame under exam conditions with your OSCEs and the knowledge that's required for your NCLEX. Preparation makes all of the difference. We're here as experts to guide you, and free advice is make sure it's not costing you in the long run. Next slide, B.
Yeah.
Thanks. So you can book a complimentary call with us on WhatsApp, or if time frame, shift work, time zones it's more convenient for you just to message us on WhatsApp, then that's perfectly okay too. You can just have a chat with us about what stream you're up to and what stages you're up to. We can also lost my words. We offer an exam handbook. So we have part of our package is a handbook that outlines everything that happens in the exams. We have practice scenarios. We've got self-assessment tools. It's a really comprehensive handbook to get you started. So that is available for sale, and you can scan the top code there if it's something you might be interested in. Similarly, we can also support you with your portfolio submission. So this is our opportunity to make sure all of those documents are correct, certified as they need to be, translated if they need to be, and we can hold your hand through all of those steps as well. So we've got our WhatsApp number there. We've got our email address if you prefer to email, and then we've got our website if you would like to check us out on our website. We're also quite active on the social media. Belginda loves a good little skills video, so you'll see plenty of her giving you some hand hygiene and bare below the elbow skills and things like that. Does anyone have any questions? I feel like I've done all of the talking. Does anybody else have any thoughts, questions, anything we've not covered you'd like to know?
If you want to talk, we can definitely unmute you.
Unmute, yeah.
Yeah. So this is your time.
Yeah.
So Lintel, if you haven't started or you haven't heard of anything, definitely get us in touch. Book a chat, a call with us through the chat. We can guide you through the process. But hopefully through today's webinar, it's given you a bit of idea how to proceed from here.
I think, Belginda, because you are screen sharing hosting, I can't unmute anybody, so might just
Oh, is that? I can. And I can't do it. Unmute. Ask to unmute. Maybe we can chat, guys. Technical problem. So definitely for those who are preparing for NCLEX, best wishes for your NCLEX. If you are taking any coaching or preparation from anyone, that's great. We would definitely recommend that do take some training, please, because that saves you not just money but time, and time is money. Honestly, trust us. That's it. Also then costs you your confidence. Once you don't go ahead with one step, definitely a little bit of guidance and assistance help you keep going.
Does taking NCLEX help? If so, how? Not sure I understand your question, Lintel. You are required to pass the NCLEX before APRA will give you your registration, but you're preparing for it will definitely help. So we do sort of advise that you have a trainer or someone who can support you through that process. It is multiple choice questions, but there's a lot of them, so being prepared is really helpful. And Jenna said, do you think 1 month to review for the NCLEX is enough? I think so. It really does come down to the amount of time and capacity you have to put into all of your preparation. If you're working full time, lots of shift work, and your family life means that your additional time to practice is limited, then it might take you a little bit longer. But if you are really motivated to be able to meet those deadlines, then I have absolute faith that you'll be able to achieve that.
Yeah, most of the courses that are available, like 2 to 3 months review.
Okay.
Courses are available. So I think it depends on like how you divide, and as Marina said, prepare. If you're quite strict with your time frames and your routine, yes, it is possible.
Yep, Jenna's planning to full time for a month to study.
Yeah, that's great.
Yep, amazing.
I just go for it.
Yeah, that's dedicated. Love it. Yeah.
And we have got Anusha just joined us. So Anusha, we are right towards the end of our webinar, but thank you for still able to make it. Tell us where you are from and where in your journey in your APRA process are you at? So we had this question up earlier, whether you're just exploring or you just heard about the process now.
Yep. Thanks for joining us, Drew. Good luck with everything.
Yeah, remember us when you need to do your OSCE review, and even send us a message or email when you pass your NCLEX. But good luck. Yeah. So
yeah. Just being mindful of the time. I think our Zoom meeting will come to an end shortly, and I do believe Zoom does just cut us off, unfortunately. But please make sure that you, Belgian, do you mind just popping on the page with our email and our WhatsApp number? If you want to take a screenshot of that so you're able to reach out to us anytime. Anisha's from Sri Lanka and hope to. Oh, great, excellent. So we will be emailing, we can email you a copy of the recording from tonight. So anything that you may have missed, then you'll be able to watch at a later date.
We also have a free, we forgot to add in here.
Oh, yes.
And another freebie. We also have a quick reference guide for self-check. Because what we found, like many candidates, they come back to us and saying that they are stuck at one step or two. So we created a quick reference guide, which we will happy to give you free in an email after the webinar when we send you the recording. so that you can follow the guide and complete your self-check, and we'll go from there. We're just being conscious of time and speeding up the process. We would like to say a nice bye to
Yeah.
you rather than being cut off. So
Yeah.
thank
Thank
you
you,
for
everyone.
joining us,
Yeah.
guys. And we will be logging out now.
Yeah. We appreciate your time and look forward to talking with you soon. Thanks, Erica.
Thank you, everyone.
Thanks, everyone. Thanks, Lintel.